Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith Rogers, producer of Public Health on Call. Thank you so much for joining us for this season of the podcast. Our last episode of Season 9 airs on May 24th and will return to kick off Season 10 on June 3rd. Next season, we'll continue to dive into some of the biggest public health questions, like how worried should I be about bird flu, and how is access to methadone changing, or what's the story behind the surge in syphilis in the Midwest. Whether you're interested in the systems, science, or solutions behind our survival, Public Health on Call is your regular dose of informed discussion. A big thank you to our talented team of audio producers who spend hours editing every episode of this podcast. Thank you to all of our guests who lend their ideas and expertise to these topics. A special thank you this season to Nicole Germo, our practicum student. Finally, we'd like to thank you, our listeners, for sharing your ideas and questions. Please keep writing us at publichealthquestion@jhu.edu, and thank you for being part of this podcast. It's graduation time at the Johns Hopkins Bloomberg School of Public Health, and today, Dr. Sharfstein catches up with one of our amazing graduates. She is the soon-to-be Dr. Francesca Marino, who has earned her PhD in epidemiology with work linking movement to cognitive problems through the creative analysis of very large data sets. Let's listen.
Francesca Marino, thank you so much for joining me on Public Health on Call, and congratulations on your upcoming graduation.
Yeah, thank you so much. I'm really excited to be here, and thank you for asking me to be part of this.
So you are a doctoral student for maybe a couple more days in epidemiology. Tell us about your background. What brought you to public health?
Sure. So I am initially a neuroscience major in college. So I've always been really interested in the brain and how that works and how different people have dementia versus don't. And so after college, I worked as a research coordinator for a number of years, really learning the practical aspects of studies, and then eventually realized that I had my own questions and own things that I was interested in, but didn't have the skills or training necessary to ask or answer those questions. So that's why I eventually applied to get my PhD in epidemiology. And yeah, from there on, hopefully I can start doing that.
So you're working in a research setting, you are starting to formulate your own questions, and you're like, maybe I could be the researcher.
Exactly.
So, for people who don't wake up every morning thinking about PhDs in epidemiology, like what does that entail? Like, you apply to the Johns Hopkins Bloomberg School of Public Health, then what happens and what happens when you get here?
Yeah, so one of the reasons that I applied for this degree is because it gives you a really broad training in being able to ask research questions and also figure out how to answer them. So if you need to design a study, if you need to use data that's already collected, how to analyze it, how to write and communicate effectively. So it's a pretty broad training that you get in kind of all of these different aspects of research. So that is why I wanted to pursue this degree. I also started at a very interesting time, which I don't think is maybe normal. I started during COVID. So I started in 2020, which was an interesting experience as well. But I think from the start, it was really exciting to finally be getting this training at Hopkins, which is, of course, such an incredible public health institution. And yeah, really just start learning and taking in as much as I possibly can, even though it was virtual in the beginning.
So at the beginning, you're taking classes in all kind of the basics of epidemiology and research in epidemiology. And then you start to narrow in on a topic for yourself. Is that right?
Yes. So the first 2 years are pretty much all classes. You get, like you said, a pretty broad training in methods and statistics. And then the Hopkins epidemiology program is unique in that there's different tracks. So depending on your research interest. So I'm in the aging track. So I took a lot of classes that were focused more on older adults, cognition, physical function, all of those kinds of things. So I started to narrow in a bit more, and then really kind of towards the end of your first year, going into your second year is when you really start thinking about your thesis topic, what you want to do for your own research, and really starting to formulate those ideas a little bit more specifically, which then informs the other classes that you take so you can really get a specialized training in what is useful for you.
Got it. And when you say the word thesis, if I had like one of those music boards, it would play like ominous music, because
yes,
that's not like a paper you write over the weekend.
Yeah, it's a culmination of many, many years, countless hours, lots of conversations. It's a big, big undertaking that it's still, I think, sinking in the fact that it's done, but it's very exciting.
So tell me about your thesis.
Yeah, so my thesis is looking at daily physical activity patterns. So basically how you move in your day-to-day environment. So not just exercise or if you go for a walk, if you go for a run, but really just how you're moving throughout your day-to-day. So whether these patterns of activity may be informative of your cognitive function. So if it can kind of give you information about if potentially there's an individual who's starting to decline cognitively, maybe starting to have some memory problems or attention problems, if these patterns can help indicate these people, which then hopefully in the future can lead to better detection of dementia and other conditions.
It's a very interesting question. How do you study that?
Yeah, it's complicated for sure. So we used data from a study called the Baltimore Longitudinal Study of Aging, which is run around here by the National Institute on Aging in the Baltimore, Washington area. So they have a really great cohort that's been studied for a long time. So they have data that we needed, and we tried to use it to the best of our ability to try to answer this question. But it is definitely a challenge, especially in older age, since with physical activity and cognition, many things go into that.
How do you know what someone's daily physical activity is? Or do they wear activity trackers? Are they videoed? Is it all recall? Like, how do you get that information?
Yeah, so we measure it objectively using a wrist device. So kind of like this is an Apple Watch, but a research grade device. So they wear it on their wrist in their just day-to-day environment for about a week. They don't have to do anything with it. They just put it on, wear it continuously, and then at the end of the collection period, it's sent back. And the researchers do some work on their end to process the data to get these patterns.
You being one of the researchers?
Yes. Yep. So we get the raw data. In some senses, you can kind of get these summaries that are already derived. And in other ways, it's great with the data sharing that we can do some of our own work to look more into it as well.
It's not a small amount of data if you're getting all kinds of motion data from all these people every day.
Yes, it's collected at 100 hertz, which means there's 100 observations for each second of wear. And then if you multiply that by the number of days that people are wearing it, these are very, very large data sets for sure. So I think we're just scratching the surface with what we're able to do with this really level of very rich, detailed data.
And you analyze it all by hand?
So we use statistical packages usually.
So either computers.
Yes, computers, not by hand.
Yeah, I was just kidding. Okay, it seems like a lot of data. If it's at the 100 per second, you can't do that by hand.
No, definitely not. I don't even know how to even begin approaching that.
So what did you find?
Yeah, so in this dissertation, we found that there were certain patterns, particularly related to your intensity of activity, just your general amount of activity, and also how broken up your patterns were. So how likely you were to be going from active, either moving around, to sitting or being sedentary. So these three general patterns were related to cognitive decline, so deterioration in your cognitive function, as well as certain risk factors for Alzheimer's disease like amyloid, as well as the genetic risk factor for Alzheimer's disease as well, ApoE4 gene. It was exciting initial work to show that these patterns are linked with kind of these early markers of potential dementia.
So this is one piece of the puzzle, but what other research could advance this or turn it into something that could be used?
Yeah, so with this project, we had a really great data set, but we were limited to data that was already collected. So I think it would be really interesting now that these types of wearable devices are starting to be a lot more popular, a lot more widely used, if we could collect these data prospectively. So meaning we start with the activity patterns and then we measure cognitive function and we look for changes and we measure all of these other biomarkers and other risk factors. So I think kind of setting our study design in that way as well, I think would be really helpful and really useful, as well as following people for longer periods of time, which is complicated, but I think would be a great next step to start to learn a little bit more.
Seems like at some point in the future, there could be like an app on your watch that says you may want to get checked up.
That would be great. I think that's the overall goal, where it's great that so many people have already adopted Apple Watches and other types of technologies into their own lives to try to understand their own health. So I think if there's more that we can do with these data to, exactly like you said, have maybe a message or something that indicates, hey, maybe there's something going on that you could get checked, I think in the future that would be really great.
I wonder if this type of work has an important equity dimension too.
Yes, absolutely. So I think the goal with these types of technologies is to be able to provide them to everyone at a low cost or either completely free, so that individuals have the opportunity to monitor their own health and then get connected with care in a way that is hopefully easier and less burdensome than currently what is going on.
So I am sure many listeners are thinking one thing: what are you going to do next after you get your degree, after everyone starts calling you Dr. Marino? What happens next?
Yeah, so for me, I would like to stay in the academic space. I really like teaching, and I really like being able to pursue these types of questions that are interesting to me. So my next step will be a postdoc, so a postdoctoral fellowship, so that I can continue to learn, continue to get more professional development, and then hopefully go on to be a faculty member or a scientist, hopefully at a university, so that I can keep asking these questions and get funding to keep this work going.
Well, I'm rooting for your success in this. It's such important work. And thank you so much for coming to Public Health on Call and telling us all about your PhD in epidemiology.
Yeah, thank you so much for having me. This is really great.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.